Hello everyone, my name is Jiahua Li from the University of Oxford. It's an honor to present at MIUA 2024. Today I will discuss multimodal deformable image registration for long COVID analysis based on progressive alignment and multi-perspective loss. Okay, to start, let's consider the global impact of COVID-19. Over 651 million cases have been reported worldwide, and approximately 65 million people are suffering from long COVID, characterized by persisting symptoms, especially affecting the lungs. Although CT scans are commonly used to detect pulmonary disease, many long COVID patients show no abnormalities in CT. Therefore, advanced image techniques like hyperpolarized xenon MRI are needed to detect lung issues. Xenon MRI is sensitive in detecting lung function abnormalities and evaluates original lung ventilation and gas transfer, as shown in this example. However, while xenon MRI provides functional insights, it needs to be analyzed alongside anatomical information, typically shown in CT scans, for effective clinical decision-making, as shown in this example. This necessitates multimodal deformable image registration to relate anatomical and functional data accurately, which is our motivation for this work. This brings us to the core of our study. The main challenge in CT and xenon MRI registration arises from differences in intensity distribution and resolution, as shown in this figure. Additionally, as a functional image modality, xenon lacks anatomical details, which many existing registration methods rely on. To address this, we use CT and proton MRI registration as an intermediate step. Since CT and proton MRI share anatomical information, moreover, xenon MRI and proton MRI are roughly aligned because they are obtained in the same session, although during different breathholds. Successful CT and proton MRI registration can thus facilitate CT and xenon MRI alignment, as shown in this example. Yeah. Therefore, our work focuses on multimodal registration between CT and proton MRI. We divide our method discussion into two parts, architecture and loss function. I will first explain the architecture. As shown in this figure, we use a progressive alignment architecture to manage large deformations across modalities. Specifically, our method involves a cascade of networks. It begins with a network predicting the affine transformation, affine transformation matrix with 12 degrees of freedom. Subsequently, multiple networks with shared weights recursively calculate the dense displacement field, leading to the final displacement field reconstructed from each network's output here, here, and here, as illustrated by this equation. Yeah. Now, let's move to the second part of our method, the loss function. Given the intrinsic intensity differences between CT and proton MRI, selecting an appropriate registration metric is challenging. Thus, we combined mutual information loss for global estimation and Gaussian pyramid label loss for local alignment. Specifically, segmentation labels were filtered using 3D Gaussian kernels at 6 different scales. We also need bending energy for regularization. The resulting loss function is summarized in the equation shown below. Yeah. For our experiments, we registered proton MRI to CT. We evaluated accuracy using the dye similarity coefficient and assessed the invertibility of the displacement field using the percentage of negative Jacobian determinants. Our dataset included 46 pairs of CT, proton-MI, and xenon-MI data, with 36 pairs for training, 5 pairs for validation, and 5 pairs for testing. We benchmarked our method against several others, including traditional multimodal registration methods like SYN and state-of-the-art deep learning based methods such as voxelmorph, RCN, recursive cascaded network, and composite net. For voxelmorph and RCN, we substituted their default loss functions with ours, MPL, multi-perspective loss function. As shown in this table, our method achieved the highest accuracy. Additionally, our method maintained the percentage of negative Jacobian determinants within an acceptable range, indicating minimal voxel inversion or folding, ensuring physically plausible and reliable registration. Okay, moving on. Here are the visualization results from various methods. The top row shows the input proton-MI image before registration and the results from state-of-the-art methods. The bottom row shows the fixed CT image overlaid with edges extracted from the proton image in green, red arrows here. Red arrows indicate areas of misalignment. Thus, after accurately registering CT and proton-MI, we applied the derived displacement field to xenon-MI. The alignment of CT and xenon-MI is shown here. Despite a few misalignments due to different breath holds during image acquisition, the registration results significantly help elucidate the relationship between anatomical and functional information in patients with pulmonary disease. Okay, to conclude, we proposed an end-to-end model for multimodal deformable image registration. We evaluated our method on challenging 3D long images from CT, proton-MI, and xenon-MI. The alignment of images across modalities holds the potential to reshape our understanding and method for long COVID research. Okay, thank you so much for listening. This is the QR code for our paper. I welcome any comments or questions you may have. Thank you.